Yeah,
also
yeah.
that close.
Gosh. Okay, well, all right, so I'll just kind of say it again. So I'm going to record this just for the few folks that can't make it. I'm going to send this out to people in a YouTube video link. It'll be an unlisted video, so you can share with whoever you need to see it. And then anyone who has questions or wants to chat or needs to schedule like a smaller meeting with like a group of their team members, I'm happy to meet again. But just kind of wanted to get things established today. So I'm gonna start. Okay, it says it's recording. Are you recording, Suzanne? Yes.
Yes, I am.
Okay, okay. Because it said stop recording, and I thought, well, I didn't start it. Okay. Great. So thanks for coming, everyone. I know most of us know each other because we were part of some work groups with different representatives of the Clackamas, Multnomah, and Washington County area branches and IRCO. Last week of September and into October, we had some meetings just to talk about our process for referrals and collaboration on cases, and I'm kind of introducing why this MOU exists and why we're meeting. Just something that was identified was that it's just challenging at times to get a release of information or an authorization for use and disclosure. In the MOU, I listed one reason why, but there's a lot of reasons why it can be hard. And again, I think from both sides, IRCO side, ODHS side, again, it's just determined that that's a challenge. And the other thing that was pretty clear is that ODHS side and on IRCO side, both sides had some reservations and concerns about sharing information about a client if they didn't have that on file. And so that's the point of this. Contractually, because we have a contract and also the information systems department of ODHS also has given access to IRCO to the track system. We already have this established and we already work together, but this MOU is just for an extra layer of liability to provide comfort for both sides. But yeah, I can share my screen a bit. It is a short document, but we also don't have to look through the whole thing. So let me just share it, give a couple highlights. Okay, yeah. So this MOU it applies for jobs, so TANF and jobs case referrals, as well as refugee cash and rep referrals. So either one would be covered under this. TANF policy team is aware of this MOU, fine with it, wanted us to move forward with it. So that's not an issue there. And again, essentially, we can go through it, but the highlights are that we identified it's a need. We identified that any delay in having the ability to share the information needed to get services started and referred over is not helpful to either the person seeking services or the offices trying to coordinate those services. And this MOU, it allows us to make those referrals, but additionally, this also meets the standards of HIPAA. It's the equivalent of what's called a business network agreement, which is a HIPAA term. And so this also covers health information. So PII and PHI, so private individual information and private health information, both can be shared under the protection of this MOU. And philosophically, the intention of the MOU is to allow us to share information mutually back and forth between both sides for the purpose of coordinating services. So, the purpose is not to share more than is needed; it's to just share what is needed. If there's not an ROI on file, and even when you have an ROI on file, that's also the philosophy of an ROI. Is you just share kind of that minimum information needed to coordinate the services. But I wanted it to be HIPAA compliant as well, in case like ODHS sends a referral and they need to share some information about maybe accommodations a person would need to participate in into employability services. So that's why we want to make sure it met HIPAA compliance as well. Um, but that's just the overall. I know I just talked a lot, but reason why this exists. Any questions so far?
I saw in the MOU we still want to try to get an ROI at some point, but this can get us going.
Yeah, absolutely. So kind of best practice is to always have the ROI. The other best practice with this is, it's good to let someone, requesting services know that, hey, like, we would like to get an ROI for you, but XYZ, if there's barriers, et cetera, we do have an agreement, with IRCO, who we'd be making this referral to share a limited amount of information to help get your services coordinated with them. So it's still best practice to give kind of a FYI about it. But yeah, but we still want to get an ROI if we can, but it's okay if it's down the road. And if it never happens for whatever reason, that's okay too. This still covers everything. Um, I think the only thing to kind of get into the details of, even though this shouldn't be really new information for this group, I copied and pasted this section right here under roles and responsibilities. These bullets come from that process document that we all put together and had a kickoff for on November 6th. This is the same stuff. The only one that was added, and I'll read through it, but the only unique bullet that was added for the MOU is that IRCO just would like some kind of confirmation that the person or the family being referred was approved for either the ref cash or TANF benefits. And I left it loose because it doesn't have to be an official document or notice with benefits amounts and all of those things. It could just be a line in the email that just says so and so, or this family was approved, or this referral has been opened for XYZ benefits. You can just pop that in there. Yeah, go ahead.
Yeah, just that it. Oh, I sound really robotic. Hopefully you can hear me.
We hear you. I do.
Okay. Within ROI, there's always the option of opting out or saying I no longer to share this personal information. Is that something that folks can decide at any point too? Because I know with an ROI, we'll have them sign it, but we'll let them know if at any point you want to opt out, they can pull it back. So is that an option, or because contractually we're supposed to share all this, is that not?
Well, yeah, so that's a great like best practice question. So yeah, I mean, if I were working the case on either side and someone told me, "Hey, I don't want my information shared anymore," etc., I mean, really all you would want to do with this is just note that in the case notes, or if your local leadership says it's a good idea, you could put something like that in a sticky note, or whatever your guidance is. But yeah, because this is meant to be kind of a placeholder for that liability piece, but it's not a document that both sides sign and detail out. There's kind of nothing to really put in the file that says that. So I guess it would be a case note, or if you wanted to upload something to the electronic file, like an email or what have you, that just says that. I mean, that could be up to you. I think how you want to process that. That's a good question, Eileen. And then I think Noor had their hand up first.
Good morning, everyone. Can you hear me?
Yes.
Okay. So I have a question. I noticed sometimes Oregonian, they don't want to share their job information with the IRCO, and then IRCO reach out to us for their job information. In that case, since we have these documents now, can we share information about their job with IRCO?
But well, again, I think that comes back to what Miley said. I mean, if someone expressly says they don't want something shared, and we do need to honor that request, a best practice was you might want to let them know how that could impact, services or their cases. Like, hey, if IRCO doesn't know blank information, this might limit how they can assist with this, or this could affect your plan, or, I mean, you would have whatever that conversation looks like, you would want to go through that. But again, same thing, you would just note it, let them know how that might impact their case, if there's any impact, and then just move accordingly. So I'm sorry that that's not more clear, but I mean, that's really just best practice for how you would handle that situation. And I saw your hand up, Stephen, but then it went down. Did you get your question answered, or?
Well, no, I was going to kind of circle back to the benefit verification piece,
Yeah.
So we could just add that into the email when we're sending the referral off with their contact information. We could just list the benefits that they're eligible for.
Yeah, totally fine. The only reason I left it vague was just to not create more work. So whatever is the least amount of work, but still just informs what they've been opened for. That's great. That means
I do know that we send Susan Glass, like, one of the things is we would send her like an eligibility statement, right? And we could always attach that for IRCO if need be.
Yes, and so that's another thing too, is I didn't want to have us completely revise the process document, but because this MOU is in place, this allows for the 415 paper application to be shared with Suzanne and or IRCO if that's helpful. Or again, this still calls out, like, as long as these bullet points are covered, whether it's typed in the body of an email, whether it's benefits verification, whether it's 415, it kind of doesn't matter what that looks like. So that's still all up to you. But these bullets just kind of clarify what needs to be covered, but it's up to your format how you want to get that information shared.
Thank you.
Yeah, good questions. Yeah, what are some other questions or I don't know, concerns? what else can I help with? Yeah, hi, Kashrat.
Good morning, everyone. Happy Friday. I just have one question. So when we share this information, do we basically like case noted in track, we say, okay, the MOU is in place and we share those information per MOU, we're sharing those information with IRCO just to be safe. Is that what we're doing?
Yeah.
And we're trying to obtain ROI later when possible. Is that how we're gonna case note something like that?
Yes, yeah. So I'm gonna my follow-up email with the video and stuff, I'm gonna note some of these kind of best practice things that everyone's called out. But I absolutely agree, that's really good practice.
Okay,
so thanks
thank
for
you.
doing that. Yeah.
Thank you.
Okay. Yeah, other hands, other questions, other comments? It technically went into effect the 4th, so it in the end this doesn't really impact our work very much, which is kind of the nice thing. It's just, this is in the background. It establishes kind of that security, that from that liability standpoint. But in the end, the work is basically going to look the same. There's not a whole lot of process changes to make, other than maybe some case notes, like you said, about the MOU being in place, or so-and-so said they don't want this kind of information shared, something like that. But it's basically the same otherwise. Yeah, Steve.
Okay, sorry. I wanted to kind of go back to the eligibility piece, the eligibility letter. I was just thinking about something, because I know in our meeting, you know, when we were doing the process, we'd kind of talked about sending separate emails to Susan Glass and to IRCO, right?
Yes.
Is that something that we could still do, since we can share all this information? You know, or could we just do it all in one email? Because that's what D15 originally was doing, and we found out we weren't supposed to be doing that.
Yeah, no, again, great question. And again, this MOU removes the need for that separate email, or to not attach the 415. And again, instead of getting the process document out for everyone to just reevaluate and reapprove, these bullet points just say what has to be shared. But it's up to you all, if it's one email, two emails, what document attached. Again, as long as it covers those bullets, your format is fine. It's not going to be a problem however you choose to share the information. So you can do your own internal process at your branch or within your team on how you want to format those referral emails.
Perfect. Thank you, Mike.
Yeah, no, great. I mean, good questions. So yeah, what else? Other things, other thoughts, questions? I wanted this to be very not painful. I wanted this to not be one new thing to memorize, or one new, process for how to complete something. Yeah, just kind of it's kind of more of a safety net as opposed to a process change thing. And from my background from previous work, I used to write MOUs between CCOs and outpatient mental health clinics and residential treatment homes. So again, I felt really confident to tackle this, again, from that HIPAA compliant standpoint, as well as the MOU writing and agreement standpoint. So yeah, it was a pretty simple process overall, but just made sure everyone felt comfortable with it. Yeah, Irina.
Yeah, I just wanted to say thank you for doing this, because it's help us to save time during this referral process. Otherwise, our intake team need to send multiple emails or wait for release of information. This is the basic information we need to know when we assign cases to workforce specialist, and having this MOU in place make the process easier.
Yeah, well, good. I'm glad it's helpful, and we did try to also keep in mind with the process document as well as this MOU, especially that bullet about the approval of benefits, regardless of whether you're saying amount or how long, or those details don't have to matter. It's about just if they're open or not, and for what, because that's also going to help with our federal partners, the Office of Refugee Resettlement. These are things they asked for in a corrective action plan from us, but it's also the more data we can provide about who received benefits and if their case was open or not open, et cetera, the more funding the state of Oregon gets, which means the more positions we can fund at our branches, which means the more policy analysts we can have on the ref team, which means the more funds we can give to IRCO and other CBOs and resettlement agency partners to do the work. So, it's just part of a larger movement of the policy team trying to get more and more data and more of the data that our federal partners want, because it's more money for more services, for more infrastructure and help. So again, just made a lot of strides this year. This is a small part
I want to add to Noor's question, because sometimes clients don't want to share their employment information because they think if they found a job by themselves, they don't have to do it, and they don't want just kind of workforce specialist to be kind of credited for that, because they think people get rewarded for for finding jobs, and sometimes, yeah, they don't want to share information with workforce specialists directly, but they provide information to family coach. Yeah, since we keep track of client records and we doing the reports, so yeah, we sometimes need to approach family coach and complete specific form for the file, and then report that's placement. So yeah, just please, if it's possible, yeah, share that information with us.
Sure. I absolutely hear that and understand that. This just reminds me, and this is for the ODHS side, is so our next policy analyst hour, which is, I'll confirm it, so February 1st, and what time? Sorry, I have too many windows open here. I'm presenting the next ref policy analyst hour. Yeah, so 8:35 to 9:25 on Thursday, February 1st. We're going to be focusing on rep disqualifications as well as the re-engagement process. Our team has updated the open manual. We've released a policy transmittal, and it hasn't been published yet, just because the training unit is still kind of reviewing and cleaning up. But we've also drafted a QRG to help you actually navigate the screens should you have to go through a disqualification process. Anyway, so I'm going to be presenting on that. Those resources, most of them are available now, but again, they'll be linked in the presentation. Happy to send those out with the follow-up email to this meeting as well. The goal is we're going to all work as hard as we can to keep people engaged and not head towards a disqualification process. But it is good we're talking about the release of information or what has to be shared between IRCO and ODHS to keep cases open and have appropriate plans and people moving forward towards their goals. So again, just this is kind of all coming together well, and is just part of that larger work of getting back into the re-engagement and disqualification process. So that presentation again so Thursday the 1st, 8:35 to 9:25. So and all that will be posted on our staff resource page as well after the presentation. So that'll be there as well when that's completed. Yeah, and then cost
I would just want to echo Irina. We really appreciate you, Mike. This has been a struggle. Having MOU in place is very important for both sides. And we do that definitely will eliminate all of those back and forth emails between IRCO and ODHS. And going back to your question, Irina, to share information, it is important to share information, and we try our best. Like when a customer has like a landed employment, we need to let IRCO know to close the cases, because we're closing the case on our side. However, many times we don't have those information too, and the reason for that is not just because the customer don't want to tell us, they don't know better. When they move here, they have so much on their plate. They just don't know. Yeah. Recently, we brought back home visits, and when we do home visits, they are just very naturally. They tell us, "Oh, I'm at work," or the wife says, "Oh, the husband is at work." So they say it naturally, and when we look at it, they've been working for several months. So again, it's not like they are trying to deceive with the system or something like that. It's just to be deceiving. It just they don't know better, but we're trying our best, and absolutely, Mike, that will help us more even when we have that more those information in place again for us. Thank you. And yeah. Mike, I'm sharing this MOU information with my staff today. Can we do that?
Yeah. So
you said you started this in the 4th.
Yeah, right.
Okay.
So it technically
Okay.
since the 4th, but there's no backdating or, it's in place. That's the whole
Okay.
point.
Okay.
Yeah, so I will, I mean, my goal is when this meeting's over, start drafting the response, getting the resources attached, all that. So that's my goal, is to get this to you after this meeting to everybody. YouTube video might take a little bit. You have to get it to a media team and blah, blah, blah. So I'll work on that too. Yeah. And again, just best practice, because we'll still end at 9:30 just to be timely and let everybody get back to whatever their needs are. But yeah, just, again, in the end, it's going to be up to, ODHS and IRCO to kind of work through those challenges. If some making the best decisions possible on if that truly means a case closure, or it just means a change in plan, or what's appropriate. So again, like that's kind of that real, like, personal human services work. But and you just note whatever they say. I mean, in the end, they own their plans more than we do, and so we just have to do our best to respect what they say, notate what they've told us, make the appropriate decisions, and move forward. But I know that everyone here has a lot of skills and expertise on how to navigate those conversations and adjust. So yeah, everyone's just doing great work, and we'll keep providing any tool or resource from our small team of 4 people that can help. We'll keep doing what we can. So just appreciate everyone here. All right. Well, we'll just wrap it up. Just thank you to everybody. Please stay safe. Keep your phones and things charged, however you're going to do that. And I'll get these notes and resources out as soon as I can today. So appreciate it.
Thanks, Mike. Thanks, all.
All right. Yeah. Thank you, everybody.